Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Furosemide. Its brand name is Lasix. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how furosemide works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe furosemide. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does furosemide work? Well, furosemide is a potent diuretic. It works by blocking the absorption of sodium and chloride in the kidney tubules. This causes an increase in urine output. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in hypertension or high blood pressure. It may be used in the treatment of edema associated with congestive heart failure. It can be used for edema, as well as pulmonary edema. With respect to contraindications or reasons we would not be able to prescribe furosemide, we wouldn't give this medication to a patient who had a hypersensitivity to furosemide or any other component of the formulation. As well, a patient with anuria, which would be the inability of the kidneys to produce urine, would also not be able to use furosemide. Now, what about dosing with furosemide? So in the treatment of hypertension or high blood pressure, the initial dose would typically be 80 milligrams orally, given daily but in divided doses. The usual dosage range would be 20 to 80 milligrams orally, daily in 2 divided doses. For edema, we may see an initial dose of 20 to 80 milligrams orally as a single dose, and then they may repeat the dose 6 to 8 hours later or increase the dose by 20 to 40 milligrams. They would then titrate or increase the dose to effect, and the maximum dose would be 600 milligrams per day. This would be for severe edema. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using furosemide, so I'll go over some of those here now. Up to 40% of patients may experience hyperuricemia. Some patients may experience hypomagnesemia, or low magnesium levels. Some patients may experience a loss of appetite or a spasm of the bladder. Now, some more rare but serious side effects would be orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, Stevens-Johnson syndrome, or toxic epidermal necrolysis. That's all we're going to talk about today with furosemide or Lasix. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Good for today. Take care.